So let's talk about the proposal where the health workers would be accommodated. How do you feel that would work then? Because will the healthcare workers then live in shifts, or will all of them then relocate from their homes and work throughout? How does that work exactly?
So the proposal is that you need 4 teams. You have teams that will move between seeing patients, quarantine after they're seeing their shift in terms of they do specific hours in a week, and they can work for 1 or 2 weeks. Actually 2 weeks, that's what is the proposal. And then after the 2 weeks, they do take a week in isolation and then get tested. And if they're tested and they turn negative, then can go to their families for a week, then come back. So it's a rotational shift. Remember, seeing these patients is very, very strenuous, and it takes a big toll on the healthcare workers. In fact, what is currently happening on the ground is that the teams are, in most cases, 2, and the healthcare workers, and they give us this feedback, are actually very strained. So it is important that we have 4 teams. We've seen countries like in Spain where they actually, the government actually nationalized some of the facilities across the country, like even private hospitals were nationalized, hotels were nationalized to be able to just respond to the pandemic. So it's something that is not based out of thin air. It is things that have been done by other countries that have been proven to work. We've seen even in the UK, even football clubs giving out their hotels specifically just to ensure that the healthcare workers are catered for and accommodated for.
So then we're talking about a possible 28-day shift, because then the incubation period of this virus is about 14 days. That means the last engagement with the patient should be 14 days, meaning the doctor will work for 14 days and then be accommodated for a further 14 days and then tested. That's when the next team comes into the accommodation, right?
So every week you'll have doctors on the ground. And remember, they're doing shifts that are both day and night. Yeah. So don't look at it in terms of day only. They're doing shifts that are both day and night. So that is where it only makes sense that you get time off, because if you Trevor, if you go to the front line specifically and you see that the way they go through the donning and the way you go through the patients, you see every patient, it is very strenuous. And remember also, you're dealing with an environment that is very high risk, to an extent that any slight mistake then puts you at risk. And it also takes a mental toll on the doctors. And so part of the break is that there's actually debrief sessions. Those are the proposals we put. Debrief sessions where the doctors, the nurses, all other frontline healthcare workers will just sit and have that debrief session on how they've seen the situation, how they are handling the situation, so that their mental status also is actually at the right in the right frame of mind to be able to see patients more effectively.
What do you think are some of the quick wins that the doctors can receive, even as you wait for these proposals to be discussed? What are some of the quick wins that can be implemented almost immediately, even just by their employers?
Yeah, so I think we've already seen one, and it's a good thing. The 5% pay reduction across board, it was for everyone, but it's something, it's a big relief for the healthcare workforce. Accommodation, I think facilities and even the government can quite quickly go around that and actually get them accommodated, meals accommodated, transport provided. Then the group life and eventually the group life cover would be good. I mean, so those are things that can be done quite easily.
Okay. You were quoted in a local daily as advocating for medics to adhere to the Occupational Safety and Health Act 2007, which then essentially allows them to take a step back from their duties should they feel unsafe. But how do you describe feeling unsafe?
I mean, Trevor, feeling unsafe is very straightforward. For each level of care, from the triage in the hospital to the A&D and even to where you're seeing patients who are COVID-19, you're required to have personal protective equipment or personal gear. So we have face masks and N95 masks, we have goggles, we have gowns, and I think those. So essentially, that is how you look at your environment. The type of patient in front of you, is it a patient who's suspected or to be infected with COVID-19 or SARS-CoV-2. So if the patient is a suspect and you do not have the adequate personal protective equipment, then that already puts you in an environment that is unsafe. And it's very clear in terms of the Occupational Safety Health Act is very clear, especially Section 13 and 14, very, very clear on the employer's responsibility and the employee's responsibility. So the employer needs to ensure that the work environment is safe and is not a hazard to the employee. The employee is supposed to ensure that they are provided with what is required for them to continue working. So in a scenario, and I think Kenyatta National Hospital 2 weeks ago was a good example where there was that standoff at A&E, suspected COVID-19 patients, and there was no personal protective equipment for the staff who were there, for the doctors, nurses, and they basically took a protective measure by ensuring that those who are coming in for the day shift do not go in, and for them they remain inside up until everything is provided. So that is basically what we are saying, and it's very practical. That the first thing you do is if it's an environment that is not healthy and is a danger to your life and health and safety, you basically take a step back, go to your facility head or even the immediate supervisor in that department, and inform them that this is the scenario, this is the situation, and because of this, I cannot be able to offer service at this point in time. So I'm telling you so that you address it. And once it is addressed, then you have no reason to continue working, basically being working in a safe environment.
And to cessation of movement because the police are resisting.
It's straightforward. If you ask me from where we sit, the Kenya Medical Practitioners and Dentists Council gave a pass, and that pass, every doctor is accessible to every doctor from the council's website. In fact, I have it here, but I can't show you. But what it has is that it has the photo of like mine has actually my photo. It has my registration number and it has my ID number. And it actually indicates that this is a curfew stroke authorization pass. Remember, what he's asking is actually a very, very valid question. That yes, he's out of Nairobi, but he's been shortlisted for an interview. And because you're currently hiring more healthcare workers, he needs to move. So that pass is very clear. It even actually has a barcode that you can scan. And remember, we don't need, even phones nowadays can scan the QR codes on phones. So if you provide that to the police and you have your national ID, because your national ID has your ID number and your photo, and the pass also has that, there should be no restriction of movement. And that is what we've been trying to say. And it is very unfortunate that we saw the event in Thika Blue Post the other day. Very unfortunate that police now decided to tear gas. And they know, they actually said that it's Monday, so we expected you to come. So when you're expecting people to come and they're supposed to offer essential services, why then not facilitate their movement and you instead now obstruct their movement? So basically for Andrew Kibet, it's simple: ID, your curfew pass, authorization pass, and you should be able to use that to move across the country.